Hi there, and welcome to my Heart Health series. I'm Dr. Misty Sens, and I'm a chiropractor and certified functional medicine practitioner. And today I want to talk with you about cholesterol and what it means to you and your health. I'm going to break this series down into a couple videos because there's a lot of information. But today I want to focus on cholesterol, the numbers that we want to see on blood work, and then eventually we will get to how you can lower your cholesterol naturally. But let's start off with understanding that heart disease is the #1 cause of death in the United States. And 50% of our population will have heart disease, and cholesterol does play a role in that. So why do we even have cholesterol? Well, cholesterol is needed for the structure of your cell membrane. It's in your human skin as a barrier. It's a precursor to steroid hormones like testosterone and estrogen. It's a precursor of bile acids, which is part of your digestive system to help break down fats. It helps with the formation of vitamin D, and it's also critical in wound healing. Now, there are two types of cholesterol that we look at typically in a common lipid panel, and that is LDL and HDL. And I love to think of these two as this. LDL is the lousy loser. That's the bad cholesterol, and we want to see that number low. And HDL is the happy, healthy cholesterol, and we want to see that number elevated on our blood work. Our total cholesterol is just the sum of all the different cholesterol parts. So we want to see that number under 200. Now understand this, when I was in school, that number was 250. So we wanted to see cholesterol under 250. But over the years, there have been certain organizations that have lowered that number. And I think it's for a pretty specific reason. We're not going to get into that today, but just know that number used to be 250. So when I look at total cholesterol, while yes, we want to see it under 200, what's more important to me is what the breakdown of those numbers are. And that's what we're going to go over here. 80% of your cholesterol is produced in the liver, and cholesterol in excess of what the liver needs is then transported in the blood inside the LDL, the lousy losers. LDL is the low density lipoprotein, and a high amount of LDL in your blood work is responsible for 70% of heart diseases. And it's the leading killer of men and women after the age of 45. LDL, that lousy loser, that bad cholesterol, we want to see that number under 100. On the flip side of that, we have HDL, that happy, healthy, high density lipoprotein. This HDL, it brings cholesterol back to the liver. So it is your worker bee. We want to see this number higher because it's heart protective, because it means it's taking the cholesterol in your bloodstream and bringing it back to the liver. But if you are between the ages of 49 and 82, the most potent risk factor for coronary artery disease is having a low HDL in your blood work. In terms of HDL, a risk factor for men and women is if your HDL is under 50 in women and under 40 in men, that causes a major risk factor for you in terms of cardiovascular disease and coronary artery disease. So where we really want to see your numbers, especially for protection of heart problems, is for women, we want to see that HDL over 65, and for men, we want to see that HDL over 55. So here's the routine lipid panel. Here it is. This is what you typically get when you go to the doctor's office. And this test is over 50 years old. We've definitely had some advances in healthcare in 50 years, but they're still using the same test. And we're still seeing more and more people with things like high cholesterol and diabetes and heart disease. I mean, it's the #1 cause of death in the United States. Listen, I wouldn't do a 50-year-old test on my dog. This test doesn't tell us everything. And that's why we utilize advanced cholesterol blood work in functional medicine to really dive deeper into what's going on with you. So that's what we're going to talk about, because here's the thing: what gets measured gets managed. So if you know what's going on, you can manage it. So there's some other markers that we look at. We look at APOB, LP little a, SD, LDL, as you can see on the screen. So I'm going to talk about those briefly here so you can get a better understanding of what those things are and why they're so important to know. So number one is, does stickiness matter? Absolutely, it does. You don't want things sticking around, right? Well, this is what we can measure with the APOB test. So remember, APOB, B is bad. So bad's going to go with that LDL. And that tells me how sticky the particles are. So the more sticky they are, the more they're hanging around in your arteries, which you don't want. And then there's APOA. A number one, A goes with the happy, healthy HDL. And this is telling me how many workers you have. Remember that HDL is the worker bees. So the more workers you have, the more you're going to be able to take that LDL and bring it back to the liver. The APOA will also tell me how strong your HDL are. I mean, you can have a lot of workers, but if they're lazy, then they're not going to do their job, right? So we can measure those things in your blood, and then we can put together a program specifically to help get those numbers where they need to be. And then, does size matter? So we've talked about stickiness. Now, does size matter? And yes, it does. 50% of heart attack victims have a normal LDL total. So what was missed? What was missed was looking at the SD LDL, the super dangerous LDL. This is looking at the size of the particles of your cholesterol. So I will tell you that bigger is better. Small is not good. So here's an analogy for you. If I come to your house and I have a bucket of rocks and a bucket of sand, which one do you want me to pour on your carpet? I hope you said rocks. Why? Because rocks is easier to clean up, right? But if I came over and poured sand, that sand's going to bore into the rug or the carpeting, and it's going to be a lot harder to clean up. It's the same thing in terms of your cholesterol in your arteries. So if you have smaller particles, they're going to bore into those arteries, and it's going to be a lot harder to clean up. So it's going to build up a lot more plaque, which you don't want, right? And then, do genetics matter? Does family matter? Absolutely, it does. But here's the thing with your genes. Your genes are there, and you can turn them on or you can turn them off. Think of your genetics as that's the gun, and your lifestyle is what pulls the trigger. So LP little a tells me something about how your body works. If you have this genetic marker, what that means to you is that your body is a plaque and clot making machine. Not good, right? Especially when it comes to heart disease and stroke. So we want to see this number really, really low. But if you have a high amount of this means that that's a genetic marker for you. And here's the thing with that. So critical to know this marker. Statins do not touch this number. There's some very specific things that help keep this number low. It can never be normal. It will never be in the normal range, but the lower it is, the more protected you are. But statins don't do anything for it. Some very specific supplementation and lifestyle. That's the only thing that's going to control this number. But it's so critical to know your risk, because you can have healthy cholesterol, total cholesterol, and you can have healthy LDL. But if you have that LP little a marker, you're still at an elevated risk for having heart disease, heart attack, cardiovascular accident. Okay? So critical to know that number. And then there's triglycerides, which is not a cholesterol per se, but they measure it in your cholesterol because it is a lipid that is made up of a fat and a sugar. And elevated triglycerides cause obesity, heart disease, diabetes, hypothyroidism, kidney disease, and liver disease. So we want to see this number nice and low. We like to see this number under 115. So understand this, looking at traditional blood work, their numbers are different than functional medicine numbers. Their numbers are basically looking at, hey, what's going to keep you subclinical? What's going to keep you from, it's basically one step away from having some type of a problem. In functional medicine, we like to look at optimal numbers because that's really what's going to protect you, your heart, and your health. Understand that cholesterol is a downstream disease, meaning there are other things that trigger the cholesterol to be elevated. So some of those triggers come from stress, and it can be any form of stress, physical, chemical, or emotional stress. When you are under stress, your body goes into fight or flight. It is an inborn reflex reaction. And when you're in fight or flight, your brain thinks that your body is under attack and you could be wounded. And if you're going to be wounded, your body wants to be prepared for that. So it elevates your cholesterol because cholesterol is critical in wound healing. So no matter what your stress is, no matter where it comes from, that cholesterol is going to be elevated. Some other risk factors for heart disease is metabolic syndrome. So if you have 3 of these risk factors, then you are at risk for developing some other chronic disease. So the 5 factors you want to look at is your waist circumference. You want to look at your triglycerides. You want to look at your HDL. Remember, HDL, that is so heart protective. You want to make sure that that number is nice and high. You want to look at blood pressure and you want to look at fasting blood sugar. Okay. So if you have 3 out of 5 of these risk factors, you now increase your risk of other problems. So if you are diagnosed with metabolic syndrome, you're 9 to 30 times more likely to develop type 2 diabetes and 2 to 4 times more likely to develop heart disease. So with women and heart disease, let's look at a really important factor here, some risk factors. Number 1, if you're a woman and you have low HDL, you're at risk. If you have diabetes, high triglycerides, a waist measurement of 35 inches or more, or any inflammatory disorder, you are at an elevated risk of having some sort of cardiovascular event. And men and heart disease, so men I think are a little bit luckier, I don't know. They only have 2 risk factors, and that is having a high LDL, low HDL ratio, and having high blood pressure as a young man. So those are some risk factors to know and be aware of, because once you know them, you can manage them. So what we're going to do next is in our next series, we're going to talk about how you can address your cholesterol and lower it naturally. So we'll see you in the next workshop.